Hi, you guys. Welcome back. Happy Nurses Week. We're here again with another Next Gen NCLEX review session for you guys. We have a fun day planned, but I hope you guys are enjoying our daily content that we've had so far this week. We'll go ahead and put up a schedule of what we have left for the rest of this week, and we'll pick up kind of like with our regularly scheduled content programming next week. We're going to focus on pediatrics, but again, today we're going to talk about 5 common Next Gen NCLEX item themes or item types, and we're going to walk through these. We'll do talk about the item themselves, but also talk about the content that's in them. So I hope it'll be helpful for you guys. I know we're getting close to like graduation and NCLEX time, so I hope these little refreshers can be good for you guys. So again, my name is Jackie. Welcome. I'll make sure that we're all set to go to kick everything off, but I think we're good to go. But again, I want to encourage you guys, if you are on TikTok, make sure and share this session with your friends. Let them know we're live. We're coming to you guys on all of our social media channels right now. As always, you can find us on demand on Facebook and YouTube. And let's see, we have 2 more sessions this week. I'm making sure I'm getting all my housekeeping things done. We'll pick up next week. And then most importantly and very exciting, we hope you guys have seen some of our social media posts this week. But in celebration of Nurses Week, we are giving away 5 30-day subscriptions to UWorld's NCLEX QBank. So make sure and answer the daily question, comment on it, like the post, and subscribe to the channel, and you'll be entered. And you can do this on all of our platforms to increase your chances of winning. But again, that's happening every day this week. So 5 giveaways just in time for graduation and NCLEX time. So we hope you guys will engage in that. And as always, use our chat today. We have our team of content experts moderating. So I guess with that being said, we'll go ahead and jump in. Again, we're going to be covering 5 common next-gen NCLEX item types. And so before we do that, though, I wanted to just kind of circle back really quickly to the clinical judgment measurement model, which we talked a lot about on Monday. But again, just bringing it up, the whole point of the next-gen NCLEX was really to incorporate clinical judgment and clinical decision-making for nurses. So what we learned after a lot of research, and really what the NCSBN learned after a lot of research, is that nurses needed to know more at an entry-level point into the healthcare system. And so this is really what this model is designed to do, is just to make sure nurses are taking a big full picture approach, thinking steps ahead in client care to make sure that we're keeping clients safe. And so as this has been kind of adopted into the test and probably adopted into a lot of your learning in nursing school, we're just going to touch on some of these points as we go through these questions so you can kind of see how it all fits together. But again, we have it up here. It really relates and kind of marries in really well with the nursing process, but just a little bit more evolved than what it was before. So okay, well, I think knowing that, we're good to go, and we'll pull up our bank. So we are really excited to preview these questions for you guys and walk through the content. And these are different than what we've done on these lives before. So this first one is called a bow tie, and bow ties are fun. You can see on the right side of the screen, it looks like a little bow tie. But what we're going to do, we're going to go through these questions. I'll read the scenario. I'll give you guys some time to answer, and then we're going to talk about how this kind of relates, first of all, back to clinical judgment, the clinical judgment measurement model, how we interact with the question. We'll go through the content, and then how it's scored. So we'll go ahead and do that, but I'm going to have us zoom in onto the left side of the screen, and I'll go ahead and read everything for you guys, and then we'll move over to the right side of the screen and kind of look at what the question looks like. Okay. So as you can see, we're starting off, we have a nurse caring for a 20-year-old client in the emergency department, and we have 3 tabs. So this is kind of what makes these next-gen items unique, is there's a scenario, there's more information than normal than just like a little intro sentence. So with all of these items, we're going to be incorporating multiple steps of the clinical judgment measurement model, but it's going to be different than a case study. So our case studies are like 6 questions back to back, and each question addresses it individually. But with this, we're going to kind of combine them in different phases. So that's a kind of a cool thing about these next gen items. Okay, so I'm going to start off by reading, and then we'll go to vital signs and lab results, then we'll switch over to the other part of the question. All right, so we have the client reports feeling lightheaded, dizzy, nauseated, and fatigued after attending an event in hot weather this afternoon. The client slept for 3 hours and then woke with severe bilateral knee pain rated as 8 on a scale of 0 to 10. Severe abdominal pain and mild chest discomfort. Medical history includes sickle cell disease. Surgical history includes splenectomy. The client takes hydroxyurea, folic acid, and NSAIDs. The client performs low-impact exercises 3 or 4 times per week and eats a balanced diet. Lung sounds are clear, S1, S2 are present, abdomen is soft and non-distended with hypoactive bowel sounds. So I'm seeing immediately here some things jumping out are sickle cell disease. Knowing big picture complications of sickle cell disease would be like our kind of vaso-occlusive crisis or sickle cell crisis. So that's kind of what's jumping out to me is like an exacerbation of sickle cell. So let's look at vital signs. I'm seeing some elevated heart rate, a little bit elevated temperature. Respirations are high. Blood pressure seems to be a little low. Oxygen seems to be a little low too. And then our lab results, I'm seeing no infection. Hemoglobin seems low. Platelets and reticulocytes seem elevated. Okay, so we're going to kind of keep all of that in the back of our mind. We're going to switch over now to the right side of the screen and look and see what the bow tie says. So, okay, this is helpful to read these instructions, and then I'm going to kind of like support that as we kind of walk through this. But as you can see, just in general, the bow tie, or how we answer these questions, it looks just like a cute little bow tie. So we're going to want to start in the middle, and the directions are going to kind of allude to this. And then we're going to move to the left where it says actions to take, then the right where it says parameters to take. So I'll read the instructions, and then I'll zoom down, or I'll scroll down so you guys can see all the options. Okay, so the nurse is reviewing the client's clinical data to prepare the client's plan of care. Complete the diagram by dragging from the choices below to specify what condition the client is most likely experiencing. So that's going to kind of tell us about our middle section there. 2 actions the nurse should take to address that condition, and 2 parameters the nurse should monitor to assess the client's progress. So I'm going to give you guys a second, but we're going to start in the middle here. And I want you guys to look at these options and use that chat. Let us know what you think the client is most likely experiencing. So I'm going to give you guys some time to answer and let you guys kind of take some time, and then I'll just, because we can't see the full screen at once, I'll give you some more like notes from the other side. But again, the client is having they have sickle cell, they seem to be dehydrated, they have high reticulocytes, they look like they are a little hypotensive, tachycardic. So I'll give you guys some second to answer. Make sure I've got all of this. And then another thing too about bow ties, just as you guys are looking at all of this, so bow ties are very unique in that they incorporate the full clinical judgment measurement model in one. So as we were reading that story, that was like steps 1 and 2 of the clinical judgment measurement model. We're recognizing, analyzing those cues. This middle column is like step 3, that prioritize hypothesis. Then step 4, actions to take, which are generate solutions. And then step 6 is, again, parameters to monitor, that evaluation step. So you can kind of see how this is an all-in-one. These questions are very, I don't know, they're very different. I'd never seen anything like it, obviously, until the Next Gen NCLEX came out. So, okay, well, you guys definitely have it. The right answer for this is going to be vaso-occlusive crisis. So what we're going to do is we're going to drag this up here. And now let's talk about some actions to take. So again, this client has sickle cell. Vaso-occlusive crisis is what happens in like an emergent or acute exacerbation of sickle cell. It happens when we get dehydrated, illness, anything like that. And so what's happening are those sickle cells are clumping together. They're obstructing blood flow and perfusion. They're causing extreme pain in kind of our joints. So when they were talking about that bilateral knee pain, that would be this. So knowing that, let's you guys put in your in the chat what you guys think the actions to take are, and then we'll move over to parameters to monitor. And then we'll submit this and you can see our explanation too. And so there we'll talk about our incorrect options too. So let's see, I'm seeing a lot of correct answers on here. Good job. Instagram, YouTube, Facebook, TikTok, you guys are definitely getting this. Good work, you guys. Awesome. Okay, I think you guys have it. So again, priority interventions are going to be administer IV fluids, and then we're also going to want to administer opioids for pain. And again, we'll talk through this a little bit more, but the biggest thing with these fluids is you want to kind of dilute that blood so that those sickled cells can unclump. We want to give them a lot of fluid, and by doing that, that's going to help a lot with our pain. And the pain with a sickle cell crisis is extreme. It's very, very painful. So we want to manage that. That's going to help bring down some of our vital signs. So with that, let's talk about parameters to monitor. So go ahead and put those in the chat, what you guys think. I probably should have saved my explanation a little bit on that until we answered this one, so sorry about that. All right, let's see. I'm seeing a lot. Good job on YouTube. I'm seeing pain. That's right. Let's see what else you guys think. And yep, Instagram, I'm seeing a lot come through. Good job, TikTok. Good job, you guys. Awesome. Okay, you guys have got it. Yes. Okay, so it's going to be pain and hemoglobin. So this is going to be how we kind of interact with this question, how we answer it. So I'm going to submit it so you guys can see a little bit more about how this will look for you guys too in our platform. But again, we had up here an option of 5 right answers. So 1, 2, 3, 4, 5. We got them all right, so we got 5 out of 5. If we were to get one wrong, we would just get 0 points for it. So we don't get a negative or anything like that. But then again, we have a really great image up here of sickle cell anemia and what really happens with it. So again, you can see those cells in sickle cell anemia, they are crescent shaped. So whenever we get dehydrated, they're going to clump and they're going to cause decreased perfusion. So what we have in here in terms of what we're going to do for a client, we're going to help them with their pain. We talked about this. We're going to give them opioids for that pain. That's going to help kind of bring down some of our concerning vital signs. We're going to give fluids. Again, we want to kind of increase the amount of fluid that these cells are circulating in so they can unclump and we can kind of resume perfusion to those to our joints and where that pain is really happening in. And then again, we want to monitor our hemoglobin. So we saw in our lab results that our client had low hemoglobin. This is kind of an expected finding when we're dealing with vaso-occlusive crisis. So some of our wrong options here, we'll talk through what some of these kind of distractors were, and you can see how the options really tied together with them. But septic arthritis, so that's going to share common manifestations as vaso-occlusive crisis in terms of pain, but the kind of patho behind it is more infection. So we're going to be doing things like, doing culture and sensitivity, taking that fluid, giving antibiotics, and monitoring what those results are. So it's sickle cell is not infective, so that's why that's not our right answer. Rhabdo can again have some of those common findings associated with like the pain and things like that, but it's going to be muscle pain, not joint pain. So our client had that knee pain. And with rhabdo, we're going to monitor our CK levels, and then we're also going to be worried about DIC, which is like our bleeding and clotting at the same time. So that's why it's that option of bleeding around the IV site is what we're going to monitor. That would be worsening rhabdo. And then lupus is going to be like our autoimmune disorder. Again, we typically aren't going to see like localized pain with that. We would see more generalized pain with lupus. And then for that, we're going to be giving kind of immunosuppressants to reduce that kind of attack our body is having on itself. So that is that. Just again to refresh, this one was about sickle cell. Our correct answers were vaso-occlusive crisis was the condition we were experiencing. To manage it, we were giving fluids and opioids, and then we were monitoring pain and hemoglobin. So I hope that was helpful for you guys. We're going to move on to our next question. Okay. So this type of question is called a which one? Oh, this is a trend. Okay, so this is unique in that you'll see, so we're going to do kind of our split screen now. You can see both sides. On the right side, we have just like a typical question, but what we have on the left side is a scenario with different tabs. So typically with a trend, we are going to see trending information, so information that progresses or changes over a period of time. So in this one, we have on the left side of the screen nurses' notes, and you'll see 2 different times. And then when we go to vital signs, you'll see trending information as well. So we're going to go ahead, we're going to read through this one, and then we'll switch over to the right side, and I'll give you guys some time to answer, and then we'll talk through it. All right. So reading this one, nurses' notes, 8 o'clock at admission. And again, this is a 73-year-old client in the emergency department. Okay, the client is brought to the emergency department by the spouse after 1 day of increasing confusion. On arrival, the client is lethargic. Neurologic examination shows no focal findings. Mucous membranes are moist. Cardiopulmonary examination reveals no abnormalities. The abdomen is soft and non-tender. A non-healing diabetic ulcer with small eschars present over the right heel. There is no purulence, tenderness, or surrounding erythema. Medical history includes type 2 diabetes, peripheral neuropathy, and coronary artery disease. And then at 10 o'clock, we have blood specimens were obtained and sent to the lab for blood cultures. A prescription for fluid bolus, 2 liters, IV normal, or 0.9% sodium chloride was received and has been initiated. Okay, and then we can see for our vital signs, I am seeing our temperature increasing, our heart rate increasing, or our pulse, our respirations worsening, and our blood pressure dropping. Our oxygen is also dropping a little bit too. So knowing all of this, what this is screaming to me is kind of like infection, probably some sepsis, especially with these vital signs. So let's move over to the other side of our screen and see what our question is. So it says, which prescription by the healthcare provider should the nurse implement next? Option 1, CT scan of the head. Option 2, foot wound debridement. Option 3, IV antibiotics. Option 4, norepinephrine infusion. So this is, question again is asking what they should implement next. So we know they've started fluids, what should happen next? So I'll give you guys some time to answer. Again, in terms, I'm just going to kind of chat while you guys are answering and see what you guys have. I'll let you guys have some time to answer, and then I'll explain a little bit more in the background. But again, this is going to be different from a bow tie, where it's not going to incorporate all steps of the clinical judgment measurement model. But again, it's going to kind of, in that left side of the screen, we recognize, analyze cues. We know a little bit about what's going on. Now we're kind of like deciding what intervention we need to do next. So it's incorporating multiple steps of the clinical judgment measurement model, but not all of them at once. This, again, is just a traditional single best item, but again, what made it different is that information we saw on the left-hand side of the screen. All right, so let's see, you guys, whoa, you guys definitely are getting it. My screen is jumping very fast, so good job, you guys. So the correct answer for this one is option 3, so we're gonna submit that. We'll take a look. So again, with this question, point for getting it right, 0 points for getting it wrong. Something kind of unique that we have, you can hit this little info button and it'll share more about how the scoring works if you're interested. But again, what we kind of talked about earlier, we're worried about this client kind of progressing to sepsis. So in the story, it mentioned that the client, blood specimens were collected. So we know we don't want to start antibiotics until we collect those blood specimens, because we don't want that to interfere with our samples. So we know the blood specimens were started, we know IV fluids were started, and we know in our sepsis bundle, those are like our priority interventions. So again, we have all of that. So we know the next thing we need to do is going to be our broad spectrum antibiotics, start attacking that infection. We also know the source of that infection is likely that foot ulcer. When we have skin breakdown like that, we have an entry point for bacteria to get into our bloodstream. So that was definitely screaming sepsis. I think you guys definitely are kind of on board with our right answer on that one. Let's look at our options that were incorrect and just why they were incorrect. So again, CT of the head, we're typically not going to be needing to do this in the immediate setting. We're trying to conquer that infection, so we can rule that out for any reason for changes in mental status, but that's definitely not our priority right now. Wound debridement for our option 2, that can be something that we do, but we're not going to need to do that until we need to do the antibiotics first. Again, this was kind of a priority. And then vasopressors can be given if our client is not responding to our IV fluid resuscitation, but we need to, again, antibiotics first. This is kind of a down the road if our client is experiencing shock. So you guys did great. A lot of right answers on that. I don't think I saw a wrong answer, so good work. All right, let's go on to our next one. So this item type is called a highlight text item. And so when we go over to where we answer the question, you'll kind of see why. But these questions can be a standalone like this, where we're answering it in like one fell swoop, or they can be part of a case study. And a lot of times you're going to see these highlight text items as the first item in your 6-question case study. So they're going to kind of set the scene. They have a lot of information in them, but you can interact with them in different ways, and we'll show you how. Okay. So I'll read this one to you guys, and then we'll go over, so we'll focus in on the left side of the screen and then hop over to the right. All right, okay. So the nurse is caring for a 51-year-old client with a chest tube placed on the left side 6 hours ago for treatment of pleural effusion. And I know you're seeing chest tube. Chest tubes are confusing. And I think maybe we can do, we'll do a live for you guys on that. I think that would be a really great topic, especially what it means for everything to be bubbling or titling, all that kind of stuff. So, okay, more to come. All right, let me read it. Okay. So our note says at 10 o'clock, the client reports pain rated as 4 on a scale of 0 to 10 during deep breathing and coughing. Respirations are 18 per minute and unlabored. Lung sounds are clear in the right lobes. Lung auscultation reveals rhonchi in the left upper lobe and muffled sounds in the left lower lobe. We have a chest tube is present in the left lung. It drains serosanguinous fluid. Suction is set at -20. The water level is continuously moving up and down in the water seal chamber. An occlusive dressing is intact with a small amount of subcutaneous emphysema noted around the insertion site. Chest tube drain output is 30 milliliters per hour. Okay, then we have 4 hours later. The client reports pain as a 6 on a scale of 0 to 10. Respirations are 22 per minute and shallow. Lung sounds include scattered crackles in the right lower lobe, bronchi in the left upper, and muffled sounds in the left lower. Serosanguinous fluid is noted in the chest tube drainage container with continuous bubbling noted in the water seal chamber. I know, the chambers, it's a lot, but it's okay. Okay, an occlusive dressing is intact with subcutaneous emphysema at the insertion site. Chest drain output is 55 milliliters per hour. Okay, it's a lot to remember, but it's okay. Just hang in there. Okay, so we're going to move over to the left side of our screen. So the question is asking us, okay, so first of all, I'm seeing we need to know how a chest tube works to answer this question. So we need to think about what is expected in terms of what a chest tube should be doing and what's not expected. And so we'll kind of walk through this question and do it that way. Okay. So this is saying, click below to highlight the one finding that requires immediate intervention. So our one thing that is like, this is not right. Okay, so with these highlight items, what you have to do is you just scroll over, and then options that are clickable are going to highlight in this pale yellow. So we can kind of go and see like pain is an option for a correct answer. Let's see what else we have. Lung sounds can be an option. The continuous bubbling noted in the water seal chamber, and then the subcutaneous emphysema, and then the chest drainage output. So talking through these, pain is to be expected when we have a chest tube in place. This pain is a little bit worse, so it went from a 4 to a 6, but this concerning, but it's not anything we're going to intervene on immediately. Let's see, we have lung sounds have scattered crackles in the right lower lobe. We're a little bit more worried about the chest tube, which is on the left side. So this is kind of here just to distract us, and it doesn't really look like anything is significantly changing with these. Let's see, we have continuous bubbling noted in the water seal chamber. So this is definitely going to be our correct answer. With the water seal chamber, when we say water sealed chamber, it's supposed to be sealed, so you don't want to see bubbling in there. So that word water seal means it's closed. It's a closed system. So if we have bubbling, that means we have air infiltrating it, which means we have a leak. So this is going to be our correct answer, and we'll kind of walk through a little bit more in the explanation. Okay, and then the other option is subcutaneous emphysema at the insertion site. A little bit of this is okay. Again, that means there's some air kind of infiltrating into that subcutaneous area, and it's making like those little like Rice Krispie feeling bubbles. So we're not seeing like a big change in this from time to time. So it's not going to be our correct answer, and nothing we can really intervene on immediately. Okay, and then chest drainage output, 55 milliliters per hour. We're seeing a little bit of an increase, which is good because we know our chest tube is draining, but it's not anything to be worried about. Like if it was over 100 milliliters per hour, that would be something to worry about. So this continuous bubbling is going to be our correct answer. And oh, you guys, I forgot to have you answer in the chat. I'm so sorry, but you guys were getting the right answer. Good job. I got ahead of myself. I got too excited. I wanted to show you how it highlighted. But as you can see, when you click it, it turns bright yellow, and that means it's your correct answer. So good work. Okay. All right, so we have an awesome picture of our chest tube on here. Again, this client was being treated for pleural effusion, which just means we have fluid in the pleural space of our lung. And so we insert that chest tube to really get to where the fluid is and allow it to drain out. Again, that continuous bubbling in the water sealed chamber means we have an air leak, so somewhere in the system. So we're going to have to like intervene on this immediately, make sure we can find where that's happening, and get it sealed off so that we don't develop a tension pneumothorax, so essentially air infiltrating that pleural space and collapsing our lung. I think I talked through the rest of these pretty much as I went through it. I'm sorry, you guys, I won't do that again. I just got way too excited. But yes, that is essentially what's happening here. Pain to be expected, we talked about that. Crackles, again, it can be like when air's moving through, but it was on the right side, so something we're not really worried about. That crepitus, we can have a little bit of that, but again, it wasn't anything to be alarmed about. And then our drainage was in a safe level. So there you have it. Okay, we'll move on to our next one. And so on this one is just a typical question we had an option of 1 point, so we got a 1 out of 1. All right, moving on to our next one. This is called a matrix multiple choice. So as you can see, we have our split screen up here. You can see what this is going to look like. Same idea. We're going to have our scenario on the left side, our where we're going to answer the question on the right side. We're going to read through this, kind of see what we have on here, and then we'll walk through these options kind of one at a time. But essentially, these are how you answer them is just like a typical single best question. You're going to just go one at a time, and you're going to pick either indicated or not indicated. So we'll go through. I'll read the scenario, and I won't answer anything this time. I'll let you guys answer. So, okay. All right. So we have the nurses caring for a 58-year-old client. Their admission note says they're in the emergency department. A client with colorectal cancer reports intractable bilious vomiting. For the past day, it is accompanied by severe colicky abdominal pain. The client cannot tolerate oral intake and has not passed gas or had a bowel movement since the symptoms began. The abdomen is distended and bowel sounds are hyperactive. Our vital signs look good. I'm seeing like an elevated heart rate, likely due to the pain and discomfort. But our respirations look okay. Our blood pressure looks okay, and our oxygen looks pretty good. So we'll what I'm kind of seeing here in terms of going back to the note, we have colorectal cancer, so maybe we can think about something, if we have a mass, it can be obstructing our GI system at some point. We're seeing vomiting, so maybe if we're thinking obstruction, something coming up from the obstruction, and then pain, and then nothing happening below a site of obstruction. So those are the things that are jumping out at me. So let's move over to the right side of the screen, and I'll read through these again. You guys just put in the chat which indications or which interventions would be you think are indicated. You can just do it like by row if you want to, and then which interventions are not indicated. Okay, so for each potential intervention, click to specify if the intervention is indicated or not indicated for the care of the client. So we have administer IV antiemetic, administer an antiemetic, insert a NG tube, place the client on a soft diet, obtain an abdominal CT, and administer a stimulant laxative. So I'll let you guys pick, let us know which ones you think are indicated. Let's see. Good job, you guys. I'm seeing good job on YouTube. I'm seeing some answers come in. Good work. TikTok, thank you guys so much. Good work. Awesome. Cool. All right, YouTube. Good job, you guys are getting this. Good work on your incorrect, not indicated interventions. All right. Cool. All right, so again, talking through this, when we were thinking about this, again, we're thinking this client has an obstruction. So our whole goal in dealing with an obstruction is to prevent worsening obstruction. So we want to stop anything from like adding to whatever is at the point of obstruction. So think about, we want the client to be NPO. We don't want any more food or liquid going down into our GI system. And then we want to do things that are going to alleviate it. So taking anything out of the body above the site of obstruction where we can access it. So kind of knowing that, and then we're also going to do some symptom management. We'll go through and kind of click these options. So administer an IV antiemetic. This is going to be indicated. So antiemetics are going to help relieve our nausea. It's going to help provide symptom relief. But the key there is IV. We don't want to give this client anything that's going to go into their abdomen. So we want to give them IV medication. We want to bypass the abdomen. Insert an NG tube. This is going to be indicated. This again is going to help relieve that pressure. It's going to pull things out of our stomach and allow the bowel to rest and provide some of that kind of decompression. Okay. Place the client on a soft diet. This is not indicated. We talked about how we want to relieve anything from coming, or we don't want to worsen the obstruction, so we don't want to put more food in there that's going to just kind of build up on top of that obstruction. Obtain an abdominal CT scan. This is indicated, so this is going to be how we can visualize if there is an obstruction. So this is an appropriate intervention or an indicated intervention, something we would do for bowel obstruction. And then administer a stimulant laxative. This is not indicated. We don't want to do anything that's going to irritate the peristalsis or anything that's going to overstimulate our bowels. So our indicated interventions are going to be rows 1, 2, and 4, and our not indicated are rows 3 and 5. All right. So again, we were right on with it being an obstruction. I should say too, for our scoring, there are 5 options here. So we had an option of 5 points and we got all of them. If we had gotten a question wrong, again, we would just get 0 points for it. So if we got 1 wrong, we would get 4 out of 5. Okay, we have, again, a really great table here that's going to summarize what a small bowel obstruction is going to look like, what it's going to present, how we diagnose it. And then we kind of talked through all of these again, but we're all about trying to relieve the obstruction, relieve anything compressing in our bowel, and then manage symptoms as well. All right. So I will move on to our next one. And again, in our just relating this back to our clinical judgment measurement model, we have this is going to incorporate multi-steps. So again, when we were reading that scenario on the left side, we're kind of taking in all the information, seeing what doesn't sound right, and then applying that onto the right side. I should also say too, just like a bonus to some of our explanations, you can see here we have really great images that are going to kind of explain anything. So we have a lot of hyperlinked images in here that you guys can check out. That's going to give you great visuals of everything. And then we also put in here, we call it our educational objective, but this is kind of like your note card information. So what we really want you guys to know about this question and that really key teaching point that's going to drive home the teaching of the question. So what's most important to know about a bowel obstruction. So you can add this to a note card and practice it or just read through it. So, and then we also have 2 videos in here as well. Okay, so let's move on to our last question. So this is called a drop-down cloze. And so whenever we move to we're going to do our split screen here so you can kind of see what it looks like. But we're going to, when we move to the right side of the screen, you can see we have 2 different like banks of drop-down options that are going to fill in the blanks of our question here. Okay, so let's move to the left side. I'll read our scenario and then we will answer on the right side. And I'll let you guys answer too. Okay, so the nurse is caring for a 22-year-old client. The nurse's note says they're in the ICU. The client underwent a right popliteal artery repair 4 hours ago and reports persistent pain rated as 10 on a scale of 0 to 10 despite IV morphine. The pain worsens with passive ankle movement. The right lower leg is swollen, tense, and tender. On palpitation, the right foot is numb, pale, and cool to the touch. Pedal pulses are palpable bilaterally. And then vital signs, we're seeing our temperature looks okay. Our heart rate's a little bit high. Respirations are a little elevated. Blood pressure is okay. Oxygen looks okay. All right, so knowing this, I will, we'll just do this one drop down at a time. So we'll move over to the right side of our screen. And the instructions are going to say, complete the following sentence by choosing from the list of options. The nurse recognizes the client is most likely experiencing. So these are our options for the first question, or for the first bank. So I will let you guys take a minute and answer, and then we'll move on to the second one. All right, thanks everyone who's following us and who's sharing our video on TikTok especially. We appreciate it. All right. Very, very cool. Good job, you guys. Good job on YouTube and Facebook. I'm seeing a lot of answers come in. Good job. Instagram, TikTok, good job. All right. Good work. This is a tricky one. All right, so I will leave that there, and then we'll move on to the second drop down. So based off what you guys think that first blank is, what do you think so it says and should, so what would be your intervention for whatever you picked in the first box? Good work. Let's see what we got. All right, let's see. YouTube, good work. TikTok, good job, guys. I'm seeing a lot of different answers, a lot of good answers. You guys are doing great. This is a hard question. We'll walk through it for you guys. Okay, so we're going to go through. So the correct answer is compartment syndrome, and then the intervention that pairs with it is going to be a fasciotomy. All right, so just again, starting with the scoring, we had 2 option choices, so we can get up to 2 points on this one. So you get a point for every correct answer. You're not penalized if you get it wrong. Okay, so what was happening with this client was compartment syndrome. So one of the things, or one of the causes of compartment syndrome can be it's enclosed pressure, but it can be after reperfusion. So anything that if we're dealing with a vessel, that can be a cause of compartment syndrome. And so anytime we have that compartment syndrome it's an acute situation, so it needs like immediate relief. And so what we worry about is like compression, decreased sensation, all of that. But we have to immediately relieve that area so that we can get some of the, whatever is compressing, we need to get it open so blood can keep flowing so we don't have any ischemia. Okay, so with that, that's how we're going to be doing a fasciotomy, which is essentially we're going to cut open where the area is, and we're going to allow the area to have room to expand, room to kind of drain, and to just relieve that pressure. So in knowing that, cellulitis, this is going to be, so for our wrong answers, cellulitis, again, is more of like a infectious situation. We didn't have any signs of infection when we were looking at our vital signs, or really in our scenario. There wasn't anything that was screaming like infection at any incision sites or anything like that. So cellulitis was like a pretty good distractor. It's going to have a lot of those same manifestations with like swelling, redness, warmth, things like that. But again, what was happening wasn't infectious with our client. Okay, and then DVT was another distractor. So again, we all know about DVT. This is something that can really happen, especially if we're in an ICU setting. We're not mobilizing a lot. We're pretty stationary or bedridden. But what wasn't correct about this one, we're not going to have like the level of pain and anything like that, and we're not going to have as much of those like neurological kind of manifestations with it as well. So again, that severe pain is more common with compartment syndrome. And then to diagnose a DVT, again, we're going to use an ultrasound, so that was kind of the option that paired with it. All right, that was it. We did great, you guys. That was our last question. Okay, yep, we will under test. Okay. All right, well, we appreciate you guys joining us today. We hope you'll come back tomorrow. We have a great session planned about how to make a winning study plan for you guys as you're preparing for the NCLEX. Again, this is the perfect time to start studying for your NCLEX if you're graduating in this semester. We have our free 7-day trial available on nursing.uworld.com, so make sure and check it out. You can see more questions just like the ones we went through today. You can see how you can interact with our questions, learn from our explanations, watch our videos. We have so much great information on there. It's definitely going to prepare you and just make you be a great nurse when you get out there into practice. But as always, make sure you follow us on all of our social media channels, interact with our posts this week for Nurses Week. We hope this was helpful to you guys. Again, it'll be available on demand on Facebook and YouTube, and we look forward to seeing you guys tomorrow. Thanks. Bye.